We're going to be joined now by Dr. Camilla Farkash-Levant, licensed practicing psychologist and organizational consultant. Camilla, we know some of the conditions these children were held in: deep underground, malnourished, not seeing the light of day, in constant terror of what will happen next, not knowing the conditions of their families. We can talk about the psychological damage as well. I mean, what are these children facing now that they're back? Because they might be back physically. That doesn't mean they're all back mentally.
So it's a very, very good question, and I'm happy that you're raising it. We are only going to be finding out the trauma for each one of them, and definitely there's going to be trauma, right? And they do need to, of course, have the assistance, and the families need to have the assistance. It's very, very important that they have the proper services, not only for the children, but also for adults in their lives. And I'm going to go back to the children for just a second. I want to focus on the adults, because how they will be received and how they will be treated and the environment that they will have will be very important in their healing and going forward, right? So we also don't know what condition each one was being held, if they were held together, if they were held separately, how they were treated during the stay over there. Were people kind to them because they're children? Yes. Or were they not so kind? And to each one, maybe they had a different experience. So it is likely also that, let's say, if the people were kind to them, maybe there were other children that they were with. Yes. So it could be that they also developed feelings of attachment to their captors, which we do see sometimes with people that do return from captivity, and especially for children. So they might actually find themselves missing the people that were holding them, if they were nice, or depending on the situation. So this is also something that will need to be handled with love and care and patience, and with appropriate therapy. That's what I'm saying. That's very, very important that the people around them also are being helped in order to know how to handle the situation. And of course, for some, as you just talked about, for some of the family members are still also back there. So it could be very, very, very confusing, especially for a child. Yes. I mean, it's confusing for an adult as well.
I mean, what sort of psychological strategies are there to even cope with this sort of situation?
There are different kinds of therapies. So, for example, there's one therapy that's very, very effective, where you actually talk to a primary caregiver or someone that's very close to a child. And the child, again, depends on age, yes? And the child will be just playing in the room. And it seems like they're not doing anything, like we're not talking to them or anything like that, except children. By the way, this is a very important point for all the parents out there when they think that while the child is in the room or some adjacent room, they're actually not listening to you when you're on the phone or arguing or talking to somebody about something that maybe it's not appropriate for a child to hear. They hear you, even though they might look like they're playing, and they actually are playing, but they do also hear you. This type of therapy is very, very effective. Sometimes it's even more effective than actually talking directly to the child, right? So it's very important to know, to like normalize the situation in terms of, the situation is crazy, obviously, but in terms of the feelings and emotions and experiences that the child might have. The normalization is very important. Play therapy is very important, because again, through play, a lot of things come through. Drawing, painting, a lot of body experiences. Yes, things to be able to catch from different directions for a child, not just for talk therapy. And again, depends on the age of the child, how young, and how the development itself. Yeah.
Camilla, one of the things we saw was a policy put in place to greet the hostages when they returned, to try to restore some sense of security. Children being greeted by soldiers who told them they're safe now. These children have experienced firsthand that that's not true, haven't they? If that's the case, how are you going to restore a sense of security to an entire generation that has seen firsthand that no, the government, the military, their parents can't keep them safe from the monsters?
It's a beautiful, brilliant question. And one of the things that I think is very, very important to understand is that we are surrounded by different countries that maybe not everyone wishes us, well. At the same time, we are armed literally to our teeth, and we are a very, very strong country. The problem is that sometimes clearly mistakes are made, or something's happening on the background that maybe we don't know yet, and who knows if we'll ever find out, yes. But overall, we do know that we have protected ourselves for many, many, many years. We have built ourselves, and something something like this has never happened, and hopefully it will never happen again, because now we're way more prepared, and hopefully we'll, grow our healthy paranoia to a much bigger scale, right? So once they were already out, and once they're greeted by the soldiers, I think it's very important to do tell them that yes, you are safe, you are back, you are here. And again, the work that we're doing, and some of it is undercover, some of it is more prominent, is very, very strong and on a massive, massive scale. So something like this, I do not foresee to be happening anytime or ever.
Camilla, certainly there are therapies, there are strategies to help most people, but most isn't all. What happens to those that ultimately can't recover?
It's a very good question, and I can tell you from, I don't know if you know this, but like most of my experience is actually also through training, and even before I started studying psychology, which is kind of interesting, but I worked with torture victims and their families for years and years, and I'm still involved with them as well. So there is exactly what you're saying. There are different kind of therapeutic techniques that will lead a person to a certain level. Sometimes the trauma, though, is so big that all you can do is basically hold the individual, but not necessarily heal them completely, yes? And that's something that's important to understand. As they grow, there are different therapies, including psychedelics and things like that we see now, that are doing something that we, by talk therapy or any other therapies, just cannot get to because the trauma is so deep. But therapies like this, of course, with the properly trained therapists in a proper environment, they are very, very helpful. And so there is like a hope at the end of the tunnel. Hopefully, again, because children are children, because they're very, very resilient, and they were treated hopefully in a humane way while being there, because they are children. Hopefully their trauma isn't going to be as deep, and again, they will heal with proper care very, very well. But if that doesn't happen, and if the residual is still there, it's good to remember that our technology, our knowledge in terms of healing and what we can offer is going forward. So hopefully by the time they're a little bit older, there are different therapies that they will be able to explore as well. And again, I cannot stress enough, the family members and whoever's around them, do please go, because you are traumatized as well. Please do go to therapy as well, and also do understand that you need to know what to do with the children at home. And the calmer you are, the more able you are to hold their experience, meaning the more you work on yourself, the more you're able to also increase the prognosis that is good for the children as well. Very, very important. It has to be a systematic kind of approach.
Well, thank you very much, Camilla, to know that despite all the horror that we've seen, there is at least some hope ahead, that there will be healing, that there will be some restoration of normalcy and restoration of so many shattered lives.
Amen, amen.
Amen.